feel sexually active and you have missed your period, and it's getting to like around the time that you're supposed to see your period, or 2 weeks after that, you start spotting and it looks like you're having an abdominal pain, this might be a sign of ectopic pregnancy. In today's video, we will be delving into the world of ectopic pregnancy. That thing that looks like is a complex thing, we're going to be breaking it down all in this video. Hi, I'm Dr. Ijomo Menoa. I'm a physician and Chevening scholar, and this channel focuses on everything women's health and career opportunities. If these are the kind of topics that you're interested in, please make sure to subscribe to the channel, give it a thumbs up, and keep watching this video. So in this video, we're going to be looking at what an ectopic pregnancy is, what causes ectopic pregnancy, different locations of an ectopic pregnancy, how to identify an ectopic pregnancy early, even before it ruptures, the symptoms, the complications, and the treatment, of course, of ectopic pregnancy. An ectopic pregnancy occurs when the fertilized ovum implants outside the uterus, and this is commonly at the fallopian tube. It can actually happen any other place, like the abdomen, the abdominal cavity, and even the cervix. So I'm going to show you this. I'm going to show you the female reproductive system so that you see what I'm talking about. So let's assume that so if you're familiar with the female reproductive system, you would know that this is the cervix, okay? This is the vagina. This is like the entrance of the uterus. So this is the vagina, okay? This is the cervix, which is the neck of the uterus, and this is the uterus. So I'll just write it here. This is the uterus, this big cavity here, okay? This is the fallopian tube. The fallopian tube, this is the ovaries, okay? This is like the fundus of the uterus, the fundus, okay? So normally, fertilization should actually happen here at the fallopian tubes, either here or here, depending on where the fertilization occurred. So if this ovary was the ovary that released an egg, then fertilization is most likely to happen here on the fallopian tube of this side, okay? So if this ovary was the one that released an ovum, it means that fertilization would happen at this side of the fallopian tube. So as you can already see, we have two fallopian tubes, the left and the right side. And since this is where fertilization occurs, it means that the fallopian tube is very important for fertilization and for pregnancy to happen. So normally, if fertilization happens in the fallopian tube, the fertilized ovum is meant to travel down all the way into the uterus to implant. So if the fertilization happened here, the ovum is supposed to travel all the way down into the uterus to implant anywhere in the uterus, anywhere around here, okay? Now, what happens in ectopic pregnancy is that the baby that has been formed at the fallopian tube will remain at the fallopian tube, which means it wasn't able to travel down to implant into the uterus, okay? So that's actually the issue. And what I'm trying to say is that there are so many places where the ectopic pregnancy can get hooked, because it's like it got hooked where it was on its way traveling to where it's supposed to go. The commonest place that this can happen, or where this hooking can happen, is at the fallopian tube, okay? So because of course it makes sense, that's where the fertilization occurred. If anything happens with the fallopian tube movement and the fertilized ovum wasn't able to move out, it will get stuck at the fallopian tube. So that's like the commonest place where ectopic pregnancy happens, okay? And I was saying that other places where it can happen, it can sometimes attach at the cervix, where it came all the way down to attach at the cervix, okay? This is where the cervix is. It can also attach at the abdominal cavity or the pelvic cavity, which is like outside the uterus. It can attach at the pelvic. Sometimes it can even attach at the ovary, okay? These are all, let me use a different color of pen so that you can see. So this is the fetus. It's meant to attach here within the uterus. But in ectopic pregnancy, we're saying that the uterus is now attached at the fallopian tube, which is the commonest place where it attaches, or it can attach at the ovaries, which means the baby is growing on the ovaries, okay? Or it can attach at the cervix, which is this place, or it can even attach outside the uterus, like outside at the pelvic cavity. So these are the different places where the fertilized ovum can implant. But the issue with implanting in any of these places is that they are not the places that has been made for it to implant in. You can see that the uterus, as small as the uterus is, once a baby comes in here and starts growing, this uterus is built in such a way that it can actually expand and accommodate the baby. Even if it's one, even if it's twin pregnancies, even if it's triplets, the womb is able to expand because of the elastic muscles there. It can expand and accommodate the fetus. But the issue is that if the fertilization is happening at the fallopian tube, which is in this place, you will see that this is a small tube. The fallopian tube is actually a very tiny tube. Like, you know, how will I explain it now? You know the size of a pen, like the inside of the pen where the ink stays is as tiny as that, okay? So the fallopian tube is a very tiny place and is not built in such a way that it can allow the muscles to expand for the baby to implant. So if a baby is now implanting on the fallopian tube and starts growing there, it means that the baby is not going to be able to see enough space to grow. And what it means is that it's going to either stop growing or rupture the fallopian tube. And we're coming to that in this video. If the pregnancy has implanted in any other place that is not in the uterus, it's not likely to survive there. It will either expand and rupture the fallopian tube, or the person will continue having bleeding and pain if it was in the cervix or any other part of the body. Okay, so that is the main issue with ectopic pregnancies. That is actually how ectopic pregnancy comes about, because the pregnancy, the fertilization has happened in the fallopian tube and is meant to move all the way down into the uterus to implant. But for some reasons, which we are going to come to in this video, which we're going to talk about in this video, it wasn't able to get into the uterus and it gets stuck wherever that happens. That is the origin of how ectopic pregnancies come about. So what causes ectopic pregnancy? Ectopic pregnancies actually occurs when there is an issue with movement of the fertilized ovum into the uterus. So for instance, if there is an issue with the movement of the fallopian tube, the way the fallopian tube is meant to be swimming around, that would allow the fertilized ovum to move down to the uterus, it becomes an issue. And one of the things that could cause this is previous pelvic surgeries, including previous cesarean section or previous appendectomy surgeries, or anything that have caused you to have a pelvic surgery done to you. This can predispose to ectopic pregnancy, because what happens is that the wound might either have healed with a lot of scarring in the abdomen. So, you know, normally when you have injury, your wound will heal and sometimes scar will form. Some people have tendency to form higher scar than the others, or stronger tendency to form scars than other people. And if there is a lot of scar within the abdominal cavity, it may have attached on the fallopian tube and then prevent the fallopian tube from actually doing its normal swimming that will allow the fertilized ovum to get to the uterus. So if anything like that, previous pelvic surgeries can predispose to ectopic pregnancy. Pelvic inflammatory disease. So this is the one we call STIs or STDs. Pelvic inflammatory disease is usually sexually transmitted infection that have caused an inflammation or injury to the pelvic tract of either the male or the female, but in this case we're talking about the female. So if there is this inflammation or injuries to the pelvic tract, which is the pelvic tract we mean here, from the vagina to the cervix to the uterus, fallopian tube, and anything along this line, it can distort the movement of the fallopian tube or the movement of processes that can happen here. And that's why when there is an STI, we try to treat it very aggressively so that it doesn't heal by scarring, or so that it doesn't cause any of these complications for the woman. So for STIs, we mean the gonorrhea, chlamydia infections, which is usually an ascending infection that starts from the outer part of the pelvic area into and goes all the way up and can even get to into the fallopian tubes, which is where the problem comes. Endometriosis. Endometriosis is when there is endometrial tissues found outside of the uterus. So the uterine tissues are found outside of the uterus, and that's why they would usually have chronic pain and, you know, cyclical pain, because what happens is that when it's time for their period to happen, those places outside of the uterus will start bleeding and the person will start having all those kind of pains. Endometriosis can actually predispose to a lot of abdominal scarring and which can affect the movement of fallopian tube, and which can also lead to an ectopic pregnancy. Remember, we said that anything that affects the normal movement, swimming movement of the fallopian tube, can predispose to ectopic pregnancy. Another cause is the use of assisted reproductive techniques. So assisted reproductive techniques are using things like in vitro fertilization, where the baby is fertilized outside of the uterus and then implanted into the uterus. I mean, these can be because it is an artificial thing that is done, whereby it's not following the natural process of fertilization. And so when the baby has been fertilized outside and implanted into the uterus, it can migrate and move around in a way that it's not supposed to go, and can even implant in the cervix, which is the commonest place where this kind of ectopic pregnancy can happen. It can implant in anywhere outside of the uterus, which can lead to ectopic pregnancy. Smoking. Smoking impairs the function or the normal movement of the fallopian tube again, and this can predispose to ectopic pregnancy. Smoking also includes even staying in an environment where people are smoking, which is called passive smoking, or even active smoking can predispose to ectopic pregnancy. Use of intrauterine devices. So this is a form of contraception which is very effective as a form of contraception. But if a woman is using an intrauterine device as a form of contraceptive, if she eventually gets pregnant, there is also a chance that an ectopic pregnancy can happen, because the intrauterine device is implanted within the uterus, and it kind of helps to release substances that will prevent fertilization from occurring. But if fertilization and implantation eventually occurs, it is most likely going to happen outside of the uterus, because of course the IUD is within the uterus. So it will find its way for the stubborn ones to implant outside of the uterus, and this will predispose to ectopic pregnancy. Maternal age. Women aged over 35 years old are already naturally much more predisposed to ectopic pregnancy. I mean, this might just be an issue of the age factor and the fact that their ovaries are also changing in structure and function. And all of these things can combine together to predispose to ectopic pregnancy. Symptoms of ectopic pregnancy. So, just like every other normal pregnancy, ectopic pregnancies would also give you the normal symptoms of pregnancy, which is the normal missing your period, the nausea and vomiting in early pregnancy, breast tenderness, and all of those signs of early pregnancies. And such that in such situation, the person will not easily be able to identify, is this an ectopic pregnancy or a normal pregnancy growing in a normal place. However, there are certain signs that might tell you that this is an ectopic pregnancy that you should be looking out for as early as possible. And also, oftentimes, this would already be a sign of complications of an ectopic pregnancy. And they include sharp or stabbing abdominal pain. This particular pain is going to be happening around the time of your period. So, I mean, some people might miss it and say that it's their period pain. But this particular abdominal pain that I'm describing is usually one-sided, and it would be much more painful compared to what a period cramp looks like. Normally, period cramps would usually be more central in the middle, showing that it's coming from the uterus. But this particular cramp that is associated with ectopic pregnancy, I mean, it might be slightly much more painful and usually lateralized to one side of the body. This is actually a warning sign. Vaginal bleeding or spotting. Some people call it spotting. So have you ever seen where someone says, it was around my period and I started spotting? The period wasn't really like that heavy. It was just like, small drops of blood coming out of my pants every day. And I'm not really sure that I will call this period. That is a very significant sign of ectopic pregnancy. Because what happens is that as the baby is growing bigger and bigger and bigger within the fallopian tube, it might start outgrowing the blood vessels that are supposed to supply it within the fallopian tube, because the fallopian tube is not the place that is made for it to grow. And so sometimes it's outgrowing the blood vessels. Sometimes it might start even leaking. There's something called leaking ectopic pregnancy, whereby the blood vessels have been ruptured and the person is bleeding into the abdominal cavity. So usually the person is actually bleeding heavily, but the blood is not coming out of the vagina, if you see. if, for instance, I think I have this, let me just demonstrate it here. So if, for instance, the fetus was at the fallopian tube and then it ruptures, the blood vessels that were supplying it in this fallopian tube will become open and start bleeding. So the issue is that oftentimes this bleeding goes into the abdominal cavity. Much of the bleeding goes into the abdominal cavity and it begins to, accumulate around the abdominal cavity, whereby the person is bleeding a lot, but we can't see the bleeding because the bleeding is not really trickling down through the cervix such that we can see it. That's the issue with bleeding in ectopic pregnancy. When the person is bleeding, the bleeding is going into the abdominal cavity. They're having a lot of abdominal pain, they're losing a lot of blood, but the only little blood that comes out of their pants, which is the one that they are likely to see, will just be a little spotting, sometimes brownish, sometimes reddish. However, this person has been bleeding internally, especially when it has ruptured. And that's why ectopic pregnancy is very life-threatening, because if the person does not notice this on time, the person can actually go into hypovolemic shock and the person can just collapse. And you will see someone in the hospital or someone that is just talking to you and all of a sudden the person collapsed and die, and just collapse, not really dying, but just collapse, means that the blood pressure has fallen so low, the person has lost a lot of blood internally such that no one knew that they were losing all this blood. That is a very significant sign of ectopic pregnancy. So if you're sexually active and you have missed your period, and it's getting to around the time that you're supposed to see your period, or 2 weeks after that, you start spotting and it looks like you're having an abdominal pain, this might be a sign of ectopic pregnancy and it will require you to check yourself, go to the hospital and have an ultrasound scan done to see if you're pregnant and to see where the baby is and to see what needs to be done for you. Another sign of ectopic pregnancy is shoulder pain. So following up from the bleeding that has accumulated within the abdomen, it might start irritating the nerve that supplies the phrenic nerve that supplies the diaphragm. And so there is this connection between when there is anything irritating the phrenic nerve and shoulder tip pain. Okay, so that's medicine. And so when the nerve that is supplying the diaphragm is being irritated by the blood that is accumulating within the abdomen, the person can start having pain at the tip of their shoulder, and this can give away an ectopic pregnancy. Dizziness or fainting. Again, just from the fact that the person is losing blood, the person might always feel dizzy and always feel tired. You always feel that your eyes are spinning, your blood pressure is low, and a lot of people might not remember to even check their blood pressure, but they just realize that they are being so dizzy. And some people would even attribute this dizziness to being pregnant, being a sign of early pregnancy, and they're not seeking help for that. This actually can be a sign of ectopic pregnancy. Early pregnancy is not likely to really give you dizziness in that way. Feeling dizziness, feeling lower abdominal pain, you've missed your period, you might or might not be spotting. These things, combined together gives out ectopic pregnancy and should definitely be checked as soon as possible. So, talking about when an ectopic pregnancy is likely to rupture, the thing is, it can actually rupture between 6 weeks to 16 weeks. It can rupture as early as 6 weeks, which is really life-threatening because at that time, the person hasn't even realized that they were pregnant. And it can also take as long as 16 weeks to rupture, which is, is in really extreme cases. And so that is why it's important to catch early where the pregnancy is located to be able to identify if this pregnancy is going to be allowed to continue to grow. And one of the ways to identify this is doing an ultrasound scan, an early ultrasound scan. And that's why you see some people say that when they are pregnant, they know they are pregnant, they don't bother about going to do the scan, especially those that have had 2 or 3 children, those that are already like the grandmas in childbearing. They already know all the signs and symptoms of pregnancy, such that even when they miss their period, they know that, oh, this one is pregnancy, I know. And they wouldn't bother checking if where the location of the pregnancy is, which is usually done in the early pregnancy scan. It becomes a very big issue. With every pregnancy, it's recommended that you go to the hospital and get checked. That early pregnancy scan is not only confirming that you're pregnant, it's also helping us to confirm where the pregnancy is located and to be sure that it is safe for the pregnancy to continue to grow there. Usually, a transvaginal ultrasound scan will be done if an ectopic pregnancy is suspected, just to find where exactly the pregnancy is, and especially if it's still very early, if it's before 6 weeks, it might be difficult to identify where the pregnancy is or identify a fetal heartbeat if you go for the scan very early. And so from 6 weeks up, the scan should be able to pick something, and you should be able to know where the pregnancy is. And I feel like this is a very important information, because we are getting to the complications of ectopic pregnancy and what can happen if an ectopic pregnancy is not actually identified. We've said, one, that the person is going to bleed, and sometimes it can be life-threatening, whereby the person bleeds to death because the person is bleeding internally and no one knows that the person is bleeding. Another complication is where the ectopic pregnancy ruptures. In this part of the world, once an ectopic pregnancy ruptured, the surgery would usually be to open up and remove the fallopian tube, because the fallopian tube has ruptured. So the fallopian tube will be removed. You can now imagine that a fallopian tube was removed out of ectopic pregnancy, and the next month or the next 2 months, the person gets pregnant again, and it becomes an ectopic pregnancy again. The person didn't know, and it ruptures again. The second fallopian tube will be removed. I mean, if we remove 2 fallopian tubes, what's going to remain? The person has become unable to naturally conceive now. The person has become unable to naturally conceive because the fallopian tubes has been removed. And that's why it looks like I'm talking about this with so much passion. I remember I saw someone who had this same case, and within a space of 3 months, she lost both fallopian tubes. This is especially common among young girls, among university students who are sexually active but do not want to come out, or do not really want to seek help. You know, those times whereby you've had sexual intercourse around your ovulation, or you've had sexual intercourse without even knowing if this was your ovulation or not, and then you've tried to conceal it, not to talk about, or not to even bother about it. And even when you're expecting your period, you're praying that let your period come out this month, let your period come out this month. The period is getting delayed by 1 week, by 2 weeks, and the next thing you start spotting, and it feels like, oh, my period is about to come, let me wait for my period to come. This is usually the typical scenario of what usually happens. And eventually, when the person faints in school, because they would usually faint in school, and their friends brings them to the hospital, it will turn out that the fallopian tube have actually ruptured. And in such cases, irrespective of your age, even if you're 14 years old, even if you're 18 years old, even if you're 30 years old, the fallopian tube will have to be removed to save the person's life. So the complications of ectopic pregnancy, we've mentioned rupture of fallopian tube, internal bleeding, infertility, whereby the person is no longer able to conceive naturally, and even the psychological impact of going through an ectopic pregnancy, the psychological impact of going through surgery, and all the the medications that will be given, and everything that has to do with going to the theater and coming out of the theater. With all of these complications, it's always better prevented than cured. So what is the treatment of ectopic pregnancy? Apart from the fact that the ones that have ruptured will have to be removed through surgery, there are other ways that an ectopic pregnancy can be treated, especially the ones that have not ruptured. So if it's identified early, you can be given a medication called methotrexate, which helps to stop the pregnancy and allows the body to absorb the pregnancy. But there are some criteria that the person needs to meet to be able to, undergo the medical treatment of an ectopic pregnancy. So it's either we use the medical treatment or the surgical treatment, depending on how early you've come, depending on other criteria like measuring the HCG, which is the pregnancy hormone level, measuring the size of the baby, and measuring or putting all of these factors together to determine whether yours will be done medically or surgically. So the surgical options could include a keyhole surgery, where where a little marks are made on the tummy, and we use very tiny instruments to go through and remove the ectopic pregnancy, or an open laparotomy surgery, where, especially when it has ruptured, where the whole fallopian tube needs to be removed, and also in emergency situations. Prevention. The main thing for preventing ectopic pregnancy, I would say, is to practice safe sex. To be honest, the fact that safe sex is underrated is something that still baffles me. Safe sex simply means knowing when you have sex, making sure that you have sex around the time that you calculate your ovulation, and which we're going to do a video on that. You make sure that you're having sex only on your safe days. Make sure that you are, consistent with one partner. Make sure that if you're not planning to have babies yet, that you have an contraceptive means in place to prevent pregnancy, and just being aware of your sexual life. Because what happens with ectopic pregnancy is when the person, like I said, doesn't know about, what is going on with their sexual life, or even how to calculate, they are not expecting to be pregnant, or they are actually expecting to be pregnant but hoping that they are not pregnant. I mean, you cannot be hoping in this kind of situation. It's about planning out what you're doing. If you know that you've had sex around your ovulation and you were not with any form of contraceptive, then you have to make sure that you do your scan early, do your pregnancy test early to know if you're pregnant, to know where the pregnancy is. So that's basically, the first thing there is safe sex. The second thing is healthy lifestyle practices. Quitting smoking, which is said can impact on the movement of the fallopian tube. Alcohol, reducing or quitting alcohol as well. And just practicing healthy diets, exercising, and just, trying on your own to be healthy. Another thing is early prenatal care. This simply means going to start your antenatal early. As soon as you miss your period, not waiting to see if the period will come and see if it's going to come later, or, as soon as you miss your period and you're worried that you expect that you might be pregnant. I'm talking about those who are sexually active. Go to your hospital, do your pregnancy test, do your scan, and start your antenatal early. And even around that early pregnancy, a lot of other tests can be done to make sure that the baby is going to be safe to grow up to the time that, we want it to get to. And also to remove all form of doubt and fears and complications that could come with the pregnancy. Also maintaining healthy reproductive health, seeking treatment for any chronic reproductive condition that you might have, like fibroid, endometriosis, making sure that you're on top of the game for all of these other reproductive system issues that might impact pregnancy. Diabetes, hypertension, making sure that you're on your medications and just optimizing your health even before pregnancy. Also starting your vitamins like folic acid before pregnancy, and even at that early stage of pregnancy will be very, very helpful. So in conclusion, ectopic pregnancy, like we've said, is a preventable, life-threatening condition. So we have two words together. Is something that can be identified early, treated, and avoiding the complications that could lead to life-threatening situations such as even death. And so I feel like this video is very important, and it has come timely for anyone who is hoping to understand what an ectopic pregnancy is and how to prevent ectopic pregnancy. If you suspect that you have an ectopic pregnancy, please seek to see your healthcare provider as soon as possible. And if you've stayed to this end of the video, please make sure to like, share, and drop your questions in the comments, and I will be able to respond to them. Thank you for staying to the end of this video, and I will see you in my next one.